let's explore some examples of fungal, parasitic, and algae diseases, including their causes, signs and symptoms, incubation periods, and common treatments. Ringworm is caused by a fungus on the surface of the skin, hair, or nails. It is not, in fact, a worm at all. The signs and symptoms include a red, itchy, circular rash on the surface of the skin. As it is caused by a fungus, the mode of transmission is usually direct contact with the fungus or a fomite that has the fungus. Treatments include antifungal topical treatments on the surface of the skin. Many of these can be obtained as over-the-counter medications. Candidiasis, also known as thrush, is a fungal infection. In this case, the fungus is a yeast that overgrows on a body part. Vaginal overgrowth is common and causes itching and altered discharge. In the mouth, there will be itching and white patches that are present. In this case, there is usually no spread of the fungus from one person to another, as this is caused by an overgrowth. There are common risk factors that are associated with increased risk of candidiasis, which include prolonged moisture on the surface of the skin, pregnancy, diabetes, taking antibiotics, and wearing bathing suits or underwear that doesn't breathe for long periods of time. Treatment includes antifungal medications, either on the surface of the skin, which can often be bought over the counter, or oral medications prescribed by a doctor. Malaria is an infection that is caused by a parasite. In this case, it is caused by a mosquito bite, which would be considered a vector spread disease. Malaria does not spread person to person. Its incubation period is 7 to 30 days after a bite. Common symptoms include fever, chills, and sweating. It can also cause extreme fatigue, jaundice, a yellowing of the skin, and abnormal bleeding. Malaria is most commonly found in African regions of the world. The best way to prevent malaria is to use bug nets and to enact widespread mosquito control. If infected, there are anti-malarial drugs that can help treat the patient. Giardiasis is another disease caused by a parasite called Giardia lamblia. This parasite infects the intestines. Giardia is spread through a contaminated water source with what we call the fecal-oral route of infection. This means where the infection from one host is present in the stool and then contaminates a water or food source that another person then ingests. The incubation period is 7 to 35 days. Signs and symptoms include diarrhea, abdominal pain, bloating, and cramping. Treatment of the Giardia parasite is to have good water sanitization methods, and, if contracted, treatment with antiparasitic drugs. As Giardia often causes lots of loose stools, treatment for dehydration is often needed as well. Protothecosis is an infection caused by algae found in water. This algae infects animals and humans, but is most commonly seen in dogs. Incubation period is 7–10 days. Signs and symptoms include ulcers or skin sores, often accompanied by a fever. In order to get this type of infection, you need to directly touch or contact the soil or water source of contamination. Prevention is the best way to prevent this type of infection, or to be careful about the water you are drinking. If contracted, there are antifungal drugs that can be used. This disease is extremely rare.